Hey guys, as a men's health expert, I am well versed in the areas of testosterone replacement, vasectomies, discussions with people about the urinary issues such as prostate enlargement and all the rest. These are all things that a men's health expert will focus on in their office. But one of the things that kind of separates out some men's health experts from others is the interest and focus on actual treatments for erectile dysfunction that go beyond medical therapy. So the idea behind penile implants is that there are men that go through the rigors of the medical treatments for erectile dysfunction, pills and shots and other therapies. In those circumstances, not everybody responds to treatment or responds as well as they should, or perhaps even some side effects from the treatments that are bothersome. Once they've gone through the standard therapies, most patients will either have a choice of saying to themselves, I think I'm done with trying to make love, or I want to get this thing fixed. The right patient for a penile implant is the following. The first is someone who at least has been educated on the therapeutic options and has tried something in the past. Most typically something like a Viagra or Cialis or one of those other drugs that we all know of. Certainly, too, we look and see from a general health perspective, are you a person that is healthy enough for a surgical procedure? The most important third is what's your interest and what's your willingness to kind of go through what a surgical implant entails. Now, the surgery itself is actually a minimally invasive procedure. Typically, the incisions we make are either above the penis or right in the scrotal sac. Those incisions are no bigger than just a 4 to 5 inches at most, typically. And that's even kind of extended things. Most often, these are the small incisions of which we can do all of the surgery and implanting the device through one incision. After that, you typically will take about a 2-week period of time in which I'm going to have you kind of relax and take care of yourself, not do a lot of heavy lifting and straining. And then in time, after you've healed, you're back in the game. Now, most often, it's going to take about a 6-week total recovery time before we'll let you have intercourse again. But the time when you invest in between that time of surgery and when you're allowed to start having sex again, that time we're going to spend on educating you on the device, doing certain maneuvers to get things prepared for you in terms of understanding and learning how to inflate, deflate, do all these different things and certain exercises to get the process started. So that way, when you're ready to have intercourse, it's not something you're fumbling around with. I think implants are great options for people, and certainly people who have failed therapies, and most importantly, folks who are looking for more spontaneity with their in their sexual life. So if that sounds like it's a treatment option for you, certainly I would love for an opportunity for us to speak and kind of go through details about the procedure some more, get an opportunity then to kind of pick the right treatment options for you in that regards. That said, the penile implant surgery, again, is a minimally invasive procedure. It typically takes under an hour, and you're home either that day or the next.